If you light a lamp for somebody, it will also brighten your path. Welcome back to the channel. We have already uploaded lectures on odontogenic cysts. Now we would start with the non-odontogenic cysts. Now let us see what are the fissural cysts. The fissural cysts are also known by the name inclusion cysts. They develop along the line of fusion between the various bones or embryonic processes. Now, these fissural cysts are true cysts. The epithelium of these cysts are derived from the epithelial cells which are trapped between the embryonic processes of bones at the line of fusion. Suppose these are two bones and they fuse with each other. So, the epithelium which is trapped between uh, these two bony processes give rise to the fissural cyst. Now, varial fissural cysts are the median anterior maxillary cyst, medial palatal cyst, globulomaxillary cyst, and the median mandibular cyst. Now, in addition to the fissural cyst, there are certain developmental cysts. These developmental cysts are derived from the embryonic structures of folds which involve the oral and adjacent soft tissue structure. The developmental cysts include the nasoalveolar cyst, palatal cysts of the neonates, thyroglossal tract cyst, benign cervical lymphoepithelial cyst, epidermoid and the dermoid cyst, and heterotropic oral gastrointestinal cyst. Now let us study each of these cysts in detail. First, in this lecture, we will be studying about the nasopalatine duct cyst. The other names are the nasopalatine canal cyst and the incisive canal cyst. It is the most common non-odontogenic cyst and it is a developmental cyst and it is non-neoplastic. It occurs in the anterior maxillary region. The pathogenesis, the persistence of the epithelial remnants gives rise to the nasopalatine duct cyst. These epithelial remnants undergo proliferation. The source of the stimuli for these proliferation may be trauma, bacterial infection, mucus retention, and genetic factors. Now, there is a different entity called as the cyst of the incisive papilla. The cyst of the incisive papilla is a nasopalatine duct cyst formed in the incisive canal or the soft tissue of the palate. So, incisive papilla cyst is a soft tissue cyst. Now, the etiology, the proliferation of the epithelial remnants give rise to the nasopalatine duct cyst. The stimuli for proliferation may be trauma, infection, mucus retention, and spontaneous proliferation. Clinical features, there is no racial predilection. Males are affected 18 to 20 times more than the females. It occurs in a wide age group from 8 to 84 years. Small cysts are mostly asymptomatic, while the larger cysts may cause swelling, discharge, pain, and the rate of growth of the cyst is slow. Seldom the cyst becomes more than 60 mm in size. So here you can see the nasopalatine duct cyst involving the anterior maxillary region. Now, the patient with nasopalatine duct cyst complains of a salty taste in the mouth. The teeth involved are non-vital or D-vital. Sometimes the cyst may cause perforation of the cortical plates. Now, the cysts of the incisive papilla are translucent. They may be blue colored and dome shaped. The blue color of the incisive papilla cyst is due to accumulation of fluid inside it. Now here you can see the incisive papilla cyst, which is a soft tissue cyst present in the anterior maxillary region. The nasopalatine duct cyst may also cause tooth displacement and bony expansion. Now the radiographic feature, the nasopalatine duct cyst has a characteristic radiographic feature that is a heart-shaped radiolucency. So here you can see a heart-shaped radiolucency in this anterior maxillary region. Now, the histopathology of the nasopalatine duct cyst. The epithelium may be squamous, columnar, cuboidal, respiratory, or a combination of all this. Melanocytes are also being reported in the epithelium of the nasopalatine duct cyst. Malignant transformation may be seen, but it is very rare. Now, the cystic wall consists of the chronic inflammatory cell infiltrate and moderately sized peripheral nerves, arteries, and veins may be reported. Certain mucous glands and adipose tissue is also seen in the cystic wall of the nasopalatine duct cyst. So here you can see this is the cystic lumen and this is the cystic lining, which may be squamous, cuboidal, columnar, or even respiratory or a combination. While this is the fibrous connective tissue wall. Now the cystic fluid is clear or straw colored and it may contain erythrocytes, leukocytes, tissue debris, bacteria and desquamated cells. The treatment of nasopalatine duct cyst is the enucleation. So the next lecture will be on the median palatal cyst. That's all for now. Happy studying.